All right, welcome back everyone. So we've completed the tutorial. Now we're going to go ahead and complete the practice examination. And again, this is content that has been developed and put out by the National Registry of Emergency Medical Technicians. This is not content that I have developed, and I am simply accessing it, using it in educational context in order to provide you all with some additional context to help you prepare for the examination if you will be taking it on or after July 1st, 2024. I have no specific relationship with the National Registry of Emergency Medical Technicians, and I am simply using this content in the context of education and education only, and I will provide links to this, so if you want to physically access this yourself, you will have the ability to do so. Thank you so much, and moving on. So let's go ahead and work through an example of this. All right, so here's our first sample question, and you can see that this is a straightforward multiple choice exam. This is essentially how it will look on the actual National Registry exam when you are actually taking it. All right, so up here you have your time remaining, and you see I can click that and make it go away, because some people seeing that time countdown can be really anxiety provoking. So if you click on it, you can just make it go away. This right here tells me what question I'm on, 1 of 15. I'm just going to click that and make it go away. All right, down here is the help in the lower left, and then right here is the calculator. If I click on the calculator, it just brings up a basic calculator that you can use. All right, so we've got 9-year-olds intubated in respiratory arrest. The assessment reveals perioral cyanosis, decreased bag valve mask compliance, and absent lung sounds on the left side. Vital signs are blood pressure, pulse, respirations, SpO2. The entitled CO2 is 58. What should the paramedic do next? So pretty straightforward, right? You look at this, you go, okay, it looks like he's developing a tension pneumothorax, and the immediate action drill here would be to perform needle decompression. All right, moving on. All right, so here is our first technology enhanced item. And again, this is not in the context of a scenario. This is just a standalone technology enhanced item. 64-year-old patients found lying on the ground in cardiac arrest. The patient's ECG is shown below. We'll look at the ECG here, and you can see that this graphic integration looks like ventricular fibrillation. And then it goes on to ask, which of the following interventions are most important for the survival of the patient? Select the 3 options that are correct. So you have a multiple select here. All right, so looking at these, I know for a fact that rapid defibrillation, this is right? So you have to identify this is ventricular fibrillation. It is a shockable pulseless arrest or shockable arrest rhythm, and rapid defibrillation is foundational to treating that. Naloxone administration, not the most important intervention for survival at this point. Intravenous line initiation, again, not critical for survival. Early chest compressions, absolutely, right? Quickly inducing hypothermia, no. Positive pressure ventilation, yes, that would play a role as well, right? So essentially what you're doing is you're providing chest compressions, ventilation, and rapid defibrillation, right? And so those are the 3. I've selected 3, and I tried to select another one, and it says you've already selected the maximum number of options allowed. So I'm going to go ahead and move on. All right, so it looks like this is another multiple choice. 6-year-old hyperresonance over the right upper chest after falling 20 feet. Blood pressure's low, heart rate's a little elevated. Saturations are low. What pathophysiology must a paramedic address first? All right, so looking at these options here, the increased intrathoracic pressure, that's putting pressure on the lung and probably the heart is our primary problem. So we'll just go with that. All right, looks like another multiple choice exam. Patient in severe sepsis is rapidly deteriorating. The paramedic observes the IV site has started oozing blood, and there's a rash developing over the chest and abdomen. Which of the following best describes the patient's condition? All right, so what appears to be going on here? Viral hemorrhagic fever, probably not likely. Viral hemorrhagic fevers are fairly rare here in the United States, and that's what this exam is focused on, providing paramedic care in the United States. Maybe something like hantavirus, but sepsis is often the result of bacteria. Necrotizing fasciitis bacteremia, that's a possibility. Thrombotic, a thrombocytopenic purpura. Disseminated intravascular coagulation. Well, we know, right, the oozing blood, right? So they're bleeding from multiple areas where you shouldn't normally bleed. That is a classic finding seen in DIC. And we know that DIC is very common in sepsis, severe sepsis, SIRS, septic shock. And we know that a rash, a purpuric rash, a petechial rash is often very common in the setting of DIC. So we'll just go with that. Again, the point of this isn't necessarily to debate on what the correct answer is. It's more to give you all an understanding of how you encounter these items and what they look like and what you need to do to answer them. All right, again, this looks like another multiple choice question. 23-year-old, 36 weeks pregnant, going to the hospital from their OB's office for dehydration. They're getting fluids at 100 milliliters an hour. Patient becomes unresponsive with facial twitching. Which of the following treatments should the paramedic administer first? So this looks to be a seizure, so we're thinking eclampsia. And, first we need to stop the seizure, right? Typically that's going to be a benzodiazepine and then followed up with something like magnesium sulfate to prevent additional seizures. So that's the answer I'll go with there. All right, here we go. Another multiple choice. So you see, we're still going to have plenty of multiple choice questions, right? So you definitely want to be comfortable answering multiple choice questions. 34-year-old, difficulty breathing, treatment plan, the patient agrees. Has the patient received informed, express, both types, neither type of consent? Looks like more of an operational question. All right, so you explain the treatment, the patient agrees, so they understand it and they agree, so we'll just select that and move on. Okay, here we go. So once you see the format of the exam change and you have that en route scene and post scene tab, you now know that you will encounter several items that will fall under the umbrella of a singular scenario. All right, so what's going to happen is it's generally going to start off with an en route. All right, so en route is open. You see I click on scene, post scene. I don't have those available because I haven't gotten to that point in the scenario. All right, so we're dispatched to a dentist's office, 32-year-old patient, weak, dizzy, and agitated. Dispatch reports the patient has a history of epilepsy, diabetes, and hyperlipidemia. Time of the call is 10:15. Response time will be 9 minutes. Paramedics partnered with an EMT and a BLS fire department engine crew is dispatched with the ambulance. Patient's located inside the office. A heavy rainfall in the area. The temperature is 42 degrees Fahrenheit, 6 Celsius. You've got a local community hospital about 12 minutes away and a comprehensive medical facility 30 minutes away. Okay, so this is kind of your dispatch information and the context of the scenario. So, en route. While en route to the scene, the paramedics considering the patient's reported medical history and what medication the patient might be taking. What common medications might be used for each of the conditions listed below? Move each condition into an answer area 2 times to correctly match it to each of the 2 medications likely used to treat that condition. All right, so here are the conditions: epilepsy, diabetes, and hyperlipidemia. All right, so you're just kind of thinking about what's going on with this patient, and you get from your dispatch that the patient has a history of epilepsy, diabetes, hyperlipidemia, and you're like, okay, what kind of home medications might be representative of these conditions? All right, so I have got 1, 2, 3, 4, 5, 6 different medications. I've got 3 treatments, and each treatment is going to be represented by 2 medications. That's what it says by use each option 2 times. So 2 of these 6 medications will be medications that would treat epilepsy. 2 of those would treat diabetes, and then 2 would treat hyperlipidemia. And so you've got to know that, right? And so this is one area where with pharmacology, you need to have a broad appreciation of pharmacology that moves just beyond the medications that you can administer. So this is actually a good question to to let you know, hey, you need to have a fairly complex understanding of pharmacology. All right, so epilepsy, well, I know that phenytoin or Dilantin is an anti-epileptic, and I know that valproic acid is also an anti-epileptic. Okay, moving on. Let's do diabetes. All right, so we know semaglutide, right? Ozempic. Everybody should be familiar with that. I know that that is an anti-diabetic medication, that was its primary use, and obviously it's used for other things as well. But those are outside of the context of this question. Let's look at lipids. Well, I know simvastatin, right? I know that's a statin, and statins are commonly used for elevated cholesterol and lipids. And I know that niacin is often used. And then that just really, and if I didn't know what this was, by process of elimination, oh yeah, okay, yeah, that's another a diabetic medication. And you can see that the registry will focus on generic names, right? So trade or brand names are not going to be commonly encountered, so you need to be familiar with generic names of medications. All right, moving on. So we're still en route. Which of the following actions should the paramedic prioritize while en route to the scene? All right, so again, you still have that en route information, and then this is just a multiple choice item. All right, so which of the following should you prioritize while en route? So this is asking en route. All right, requesting additional engine crew, where you already have an engine crew going with you. Determining patient allergies, well, that's not really something you can do until you get on scene. Contacting medical control, well, there's really no reason for you to contact medical control at this point because it's asking en route. Assigning responsibilities, that seems a reasonable answer, right? You're reviewing the dispatch information. You're trying to figure out what, just get a basic understanding based on the information available, what might be going on. And then, hey, here's my crew, here's my team, this is what I want you all to do. And you kind of have that prepared prior to patient contact. Okay, so now we're moved to the scene, but if you click on the en route option, I still have that information available. I don't have the questions, the items that I answered, I just have the information that's given to me. So I can go back and review the dispatch or en route information, but now we're on scene. So we get on scene, 60-kilogram patient sitting awake in the dental suite. Paramedic approaches, anxious, says, leave me alone, I'm just fine, get away from me. Paramedic that the patient reported feeling weak. Upon arrival, then confused, so the patient was instructed to start fasting at midnight for a dental procedure today. Staff confirms a history of epilepsy, diabetes, and elevated lipids. Has recently had dental pain. Patient's medications include insulin that is being administered by an external pump, carbamazepine, hydrocodone, acetaminophen, and atorvastatin. So you carbamazepine, I know that's an anti-seizure med, hydrocodone or acetaminophen's pain, right? That's a Lortab or Vicodin, and then atorvastatin is a statin for lipids or for cholesterol. Patient has no allergies to medications, so skin's diaphoretic, no signs of trauma, obeys motor commands and moves all extremities, cannot give their name, location, or the date. Eyes are open, pupils are 5 and reactive, breath sounds are clear bilaterally. Vital signs, you can note them here. Blood glucose is 47, in vitals 40. Looks like you got an ECG. It looks like sinus tachycardia. And you got these little triangles here, or inverted triangles, denoting that this is a 6-second strip. All right. And again, you could use Control plus to zoom in on that if you wanted to, and Control minus to zoom out. Which sign most strongly indicates acute hypoglycemia in this patient? So all this is going on, and this is asking, okay, what suggests acute hypoglycemia? All right, in this particular patient here, obviously the elephant in the room is the low-hanging fruit is the blood sugar's low, but that's not what is that's not one of the things you can ask. Right, all of these are potential answers, right? Your pulse can go up, your pupils may or may not change their size, your skin condition can change, but probably the best answer here, given the information available, is going to be the mental status, because she is acutely confused, and that is probably going to be the best answer to go with here. All right, moving on. All right, so you see these little square boxes, so you see how the question moved from circles to squares. This is letting you know, oh, I've got a multiple answer item here. So which are the most likely causes of the patient's current presentation? Select 2 to answer that are correct. All right, so you have to select 2 of these. Most likely causes. All right, so looking at these, obviously she's been fasting, so she hasn't had anything to eat, but she's got that insulin pump moving, right? So that would be pretty obvious. And then insulin dose management would probably be the next most obvious, right? Her pump is still going. She's still receiving insulin. Is that necessarily appropriate, being that she's fasting, right? So all of these are potentially correct to some extent, but these 2 are the most likely given the context of the scenario. So you can see how these enhanced items are really forcing you to engage in higher level critical thinking than just your standard multiple choice items. Okay, moving on. So this looks like we're going to have to build a list. All right, based on the patient findings and history, what condition should the paramedic most strongly suspect as the cause of the emergency? So this is asking you essentially about differential diagnoses. In the answer, to correctly order from most likely to least likely. All right, so here are the items. All right, so clearly a diabetic emergency seems to be the most likely thing, right? Based on everything we're seeing here. All right, so that's going to be the most likely. Moving on. All right. Let's see, respiratory rate's 10, SpO2 is 95, so respiratory distress is probably going to be way down there with the least likely. And then it's kind of between stroke and seizure. Let's see, she obeys motor commands, cannot give her name, location, or the date. So there isn't anything that is pointing toward a seizure, and so stroke is probably going to be the next one, and then seizure I want up there. So what I can do is I can take seizure and I can just move it up there. All right, so this would be my answer: diabetic emergency, stroke, seizure, and respiratory distress. And you can see I have these options that can, if I select one of these and I want respiratory distress to move up, I can move it up like that. Or if I want to move it down, I select it and click the down arrow like so. All right, moving on down. All right, so we're still on scene. What first line treatment should the paramedic perform? If the patient's condition does not improve, what second line treatment should be performed? What treatments are not indicated? Move each option 2 times to correctly show. So essentially what this is saying here is what do I want to do first? If that doesn't work, what would I do second? If that does, and then what would I not do at all? All right, what would I not do at all? So first line treatments, 2 of these 6 options are first-line treatment. All right, so you kind of look at this and you go, well, what do we got here? I don't know. Let's see. Well, let's see. Let's go back to the scene here. So she obeys motor commands, moves all extremities. So, her airway is patent and she isn't unresponsive. So, right, a first-line treatment might be the administration of oral glucose. All right. And then you might think, well, I want to give dextrose, right? I want to administer dextrose, but that requires IV access, right? So then my 2 first line would be getting an IV and then giving dextrose. But that doesn't make sense given the answers I have, right? Because that is going to require, more time, and because I have the ability to give it orally, maybe you want to think about giving it orally prior to having to do more invasive procedures on the patient. And then glucagon is a reasonable first-line agent if you have the ability to do it. Now, you can really get yourself into trouble with these questions if you try to inject your personal experience. Like, well, we don't even carry glucagon where I work or where I did clinicals. Well, tough. That's not what the question's asking. The question is asking what would be considered first-line treatments, and oral glucose and glucagon are generally considered first-line treatments in patients who don't have airway compromise, even though that may not be what you are used to doing at your service, right? These questions are broad, general questions, so you really want to be able to generalize pre-hospital care. And then second-line treatments, right? So you gave some oral glucose, that didn't work. Now what? Well, then at that point, getting an IV established is going to be important, and administering dextrose to increase the blood sugar. And then not indicated at this time, well, the patient's breathing just fine. Their lungs are clear. They're not having any respiratory distress. The rate is fine. The SpO2's in the mid-90s. So giving oxygen is really not indicated. And then continue ECG monitoring. Well, you've got an ECG. It's sinus tachycardia. There's no ectopy, and it's wholly consistent with hypoglycemia. So there's really nothing more to be gleaned from the ECG at this point, and so I'm going to answer that. All right, so you can see this is a pretty complex cognition going on here. Okay, so now we're post-scene. So after receiving a dextrose administration, so do not let this trip you up, right? Because that prior question asked about primary and secondary, and then it says, oh, after giving dextrose, a patient pulls out the IV line. So then you might think, oh, I should have answered dextrose first, right? Don't do that to yourself. Just take the information as it comes. Okay, so here we are post-scene. Patient got dextrose. Patient pulls out the IV, says, where am I? When did I get here? Then they vomit. They have pale, cool, diaphoretic skin. They're not following commands. Their eyes are open. Pupils are, blood pressure is as you see it there. Temperature and the blood glucose as well as entitled CO2. Okay, so again, you can click on scene and go back to the information that you got on scene, and even all the way back to the dispatch information and en route information. But here we are post-scene in the back of the ambulance. This is what's happened. There's my ECG. It looks generally unchanged. Okay, so consider how blood glucose levels are affected by pancreatic hormones, insulin, glucagon. What are the actions of insulin and glucagon, and what are their sources? All right, so here's insulin. So select one action and one source. All right, so we know that insulin, what does it do? Well, it stimulates cellular uptake of glucose, right? And then I need to select one source. Where does insulin come from? So this is the action, this is the source, and we know that insulin comes from the pancreatic beta cells and the islets of Langerhans. And then I need to move on to glucagon. Glucagon stimulates the release of glycogen. Glycogen then breaks down into glucose, and we know that glucagon comes from the islet of Langerhans alpha cells. Okay, moving on. Which of the following treatments should the paramedic provide at this time? Select 3 options that are correct. So, deliver a fluid bolus. Well, the blood pressure is actually a little elevated, and there's no history of fluid loss. That doesn't seem reasonable. Ventilate with a BVM. Well, her saturation's still in the mid-90s, and she's breathing 12 times a minute. That doesn't seem reasonable. Administer oral glucose. Well, she's vomiting now, right? So giving anything orally is not going to be a good idea. So I'm already eliminating things. So it does make sense that we need to get another IV, right? Because we can't give additional glucose orally. And then we need to give her more dextrose. And then because she's vomiting, it would make sense maybe some ondansetron or Zofran to help out with that, right? And now we've selected 3 options. And I'm going to moving on. Because of changes in the patient's condition, which of the following actions would be most beneficial? Select 2 answers. Okay, so I look at these. Deliver a fluid bolus. Again, there just doesn't seem to be any reason to give a fluid bolus. High flow oxygen. Again, there's no indications for that at this time. Discontinue insulin delivery. What? What's that all about? Why? I'm not giving her insulin. I don't understand that. Oh, well, guess what? We can go back and look through our prior information. The scene. Is there something on the scene? Oh, look at this. She has insulin, and it is being administered by an external. Oh, that's right. She has an insulin pump giving her insulin. Oh, I need to turn that thing off. That's definitely got to be one of the 2 answers. And then the rest, sit the patient upright, leaning forward. Oh, yeah, she's vomiting. I want to protect her airway. ABCs. All right, there you go. Those are the 2 best answers. And we have completed the sample items at this time. And that's it as far as the sample questions are concerned. I hope that you found this to be a helpful and fruitful experience. Thank you all so much, and we'll see you in the next video.